Mrs. Jones.
Hi.
So let's continue our discussion. So you were telling me that you haven't felt like yourself for the last 2 months and that you've been frustrated by waking up in the middle of the night. Can you tell me a little bit more about that?
Well, I feel like I might be having hot flashes. I'm fine when I'm going to sleep, but then by the middle of the night, I'm sweating and it just wakes me up. I have a hard time going back to sleep, and this happens like 2 or 3 times a night. I feel like I'm only getting about 4 hours of sleep per night.
That sounds hard. So those do sound like hot flashes, which can happen around the transition to menopause. Can you tell me where you are with that? How frequently are you having periods these days?
Well, they used to be regular, like every 28 days, but for the last 6 months, it feels like I'm skipping a month, and then it happens like every 50 days or every other month, and they're definitely longer and heavier. The irritability seems to be worse before they come, and then it gets better for a few days, but lately it just seems like I'm more irritable most of the time.
So it sounds like with these less frequent periods, you've started perimenopause, the time leading up to menopause, which can be a time of an increased risk for depression. There are also some other symptoms that can go along with perimenopause. Can I ask you about those?
Sure.
So I think why don't we actually take a look at this list on the menopause rating scale. So some people notice more aches and pains, bladder problems, weight gain, changes in sexual function, and cognitive changes. Have you noticed any of those?
Well, I definitely feel achier, and my right knee's been bothering me more, so I've stopped going to the gym. I don't have bladder problems except when I cough, and sometimes I lose a little urine. But honestly, that's happened ever since my second pregnancy, and it's pretty minor. I've definitely gained, though, like about 7 pounds in the last 6 months, and that's getting me down because my clothes aren't starting to fit. Sex has not been appealing at all for the last 6 months, probably. Last time it was painful, and I don't really like the way that I look right now. So it does seem like I do have some of these symptoms. What do you mean by cognitive changes?
Yeah, that's a great question. So sometimes people describe fogginess or difficulty remembering things, word finding difficulty, poor concentration, or problems functioning at work.
I mean, I've been doing things like forgetting my keys and my phone, and I never used to do that. Also, I feel like I can't remember names that I definitely should know. It's really embarrassing. Like if I haven't seen a neighbor for a while and I can't remember their name at the moment. Also, I can't sometimes remember if I've done something already or not. So for example, like if I've already made an appointment or if I've moved the laundry from the washer to the dryer. I actually feel like I'm wondering if something is really wrong with me, like maybe I have early dementia. And what if I'm not able to do my job properly?
So, why don't we address the worries I've heard so far by talking a little bit about the changes that can be caused by perimenopause. So it's not uncommon to have some weight gain with the change in hormones that occur during this time, as well as body aches or other physical symptoms. So figuring out an exercise regimen that works for you and making some dietary changes might be helpful. You also mentioned having some pain during sex.
Yeah.
So sometimes that can be helped or related to vaginal dryness or atrophy, which can happen during this transition. You could start with over-the-counter water-based lubricants before sex or daily moisturizers. But it sounds like a good idea to check in with your OBGYN about it. Make sure there's not some other cause. And discuss options like vaginal estrogen if the over-the-counter products don't work. It's also important to communicate with your partner about this change so that you practice sex in a way that tries to reduce this pain. As for the possible memory problems, we can do a simple test today that can screen for any major problems. If there are changes related to perimenopause, they're usually very subtle, involving problems with attention, verbal memory, and learning new things, and can often be addressed with organizational strategies. Finally, all of these symptoms can be related to depression and anxiety, as well as stressors or other medical problems. So let's talk more about these and whether anxiety or depression, which we can treat with either therapy, medication, or both, might be contributing.